quick break here. Speaking of which, Michael Moore's Sicko, it's up for an Oscar, and that has someone here worried sick that tomorrow's award show will give national health care a starring role in your life, maybe soon. Well, the big winner at the Oscars could be national health care. Michael Moore's controversial documentary Sicko is up for one of those little gold men. Moore is hoping for a rerun of last year. Remember Al Gore's Inconvenient Truth? It won, and now most politicians, indeed most businesses, have signed on to fight global warming. But will Michael Moore's dream of universal health care come true? All right, Mark, what do you think?
Well, I mean, certainly a victory at the Oscars will push this to the forefront of the national conscience. We saw this with Inconvenient Truth. We saw it last week with Amy Winehouse, who, you know, made an Oscar, had a Grammy win, and then went to the top of the chart. So if he wins, Michael Moore's agenda will be at the forefront of our conversation. Will that translate into universal health care? Of course not. Even Barack Obama, who's the best chance for that, is not for universal health care in the way that even Hillary Clinton or John Edward was. So we won't see universal health care, but what we will see is a very concentrated conversation between McCain and Barack Obama about national health care.
Well, by the way, Amy Winehouse does need good health care. That's a minimum. Charles, what do you make of it?
Well, she gets a lot of meds now. But listen, at the end of the day, an Inconvenient Truth, actually, at the end of the day, this whole green movement is turning out to be a godsend for corporate America. All you have to do is take a shampoo, put green on it, and sell it for 10 cents more. I mean, really, they're making so much money off of this thing. Conversely, they can't do the same thing with national health care. I'm a small business owner. Health care is really tough at this point. And all you have to do is look at all the other countries that have it. You know, we hear in the movie Sicko how great these other places are, but we don't hear they make significantly less than we do. They're taxed significantly more than we are. And then a lot of people actually die on the waiting list for this free service. Americans really don't want that.
Ben Stein, what do you think?
I think that the Oscars will have nothing to do whatsoever with the health care debate, but I think we cannot afford universal health care at this point unless we're going to have a major tax increase on the wealthy, which I think is coming down the pike. Anyway, this country is tapped out. For the middle class, no more taxes on them, period. That's done. It's going to be all people like you, Mr. Cavuto, who are going to be paying the taxes, and you're going to be paying a lot more of them.
But that's a moral imperative. We have to pay more in order to take care of people who don't have it.
I'm afraid that is true. I think you're right. It is a moral imperative. You're absolutely right.
Why is it a moral imperative to spend more on
Because
government?
It's outrageous that that there's a 2-year waiting list for Bentleys, that houses in Palm Desert and certain clubs are $7, $8, $9 million, that people pay $300,000 to join golf clubs, and other people who are perfectly good Americans cannot afford health care.
Exactly.
That is an outrage.
So, well,
Thank you, Ben.
I'm outraged by your outrage because, Tracy, I do not find the equivalent of a moral imperative to build a bigger government. I don't care on whose backs it's on.
It's not a bigger government. It's taking care of the least among us.
Exactly.
No. That is just a red herring.
It isn't.
No, what you presented was a red herring, Neil. This is about taking care of people who don't have health care.
But leaving aside the fact that you've grossly exaggerated the number of people who don't have health insurance in this country, I'm addressing the bigger issue of automatically assuming the government has all the solutions, Tracy. That, to me,
it isn't.
That to me is the moral outrage.
It's unfair. It's unfair. You come to this country because you can make a living and make your own money, and if I want to buy a $300,000 Bentley, which someday I hope I can, I'm going to buy one. And I don't think I should be taxed more because I worked very hard and missed multiple nights with my children because of it.
Well, Ben Stein, I want to get back to you on a key point. At what point do you think, then, it is an acceptable level for the rich to compensate for the guilt they should feel for the Bentleys? Now, if it's wait a minute. If it's a 35% rate now, it had been 39.6. Do you want us to return to that? Do you want the surtax that Charlie Rangel is talking about that would bring it up to 44, 45%? What to you is acceptable?
I am around incredibly rich people all day and all night. Believe me, they're not suffering. They pay another 5 percentage points at the top of their marginal rate. It won't hurt them one darn bit. If they pay another 10%, it won't hurt them one darn bit. They'll still be rich.
Ben and Mark, this is what I'm really worried about, though. This is what will be hurt, the American work ethic. In other words, you know what? There are a whole bunch of people right now who have been sort of appeased. We saw it with welfare and other things. You can take away the innate ability of people to succeed by saying it's not not your fault. The rich people succeeded at your expense, and we're going to give it to
Charles,
you.
look.
No, but people, that's ridiculous.
That is
absurd. That is absurd. People are not deprived health care because of the lack of work ethic. It's not like people aren't getting health care because they're not working hard enough. These are people who work every day and don't have adequate health care. They either have none or they have inadequate health care.
But Mark,
and a lot of people I'm talking about are playing golf anyway. A lot of the people I'm talking about are playing golf all day anyway.
That's insulting, and you know it. Now, Adam Lashinsky, I want to go to you. I just think that built in this argument for more government, either to provide health care or other means, and taxing the rich to provide it, inherent is that argument is that the rich are greedy bastards and have gotten that way.
No, it isn't.
It isn't. Let Adam answer.
Hold on, everybody.
I'll get you, Ben. Go ahead, Adam.
But Neil, I think that's asking the wrong question. It doesn't matter if the rich are greedy. It doesn't matter if we agree or disagree that government needs to be the solution. If people go out and see the movie, which is a blunt hammer, he only knows how to use a blunt hammer. He makes some interesting points, which are that we don't have adequate health care and that the insurance system doesn't work all that well.
Exactly.
Now, we can have an ideological debate about do we need more government, or we can have a policy debate about how do we solve those problems.
I'm going to end with Ben Stein, who first raised it. The idea being that in order to rectify all that ills society, stick it to the wealthy because a lot of them can well afford it.
He didn't say that.
No, because in a society like this, the rich get a disproportionate share of the benefits. They get the poor going off to fight for them. They get the poor cleaning up their golf course. They get the poor washing their cars. They can pay it.
Guys, we got to take a break. That is an unfair slap. Of course, the rich need no lobby, but you're saying they're all golfing, all doing nothing. It's insulting.
They're not all doing that.
Well,
a lot of them are doing that.
Oi, as you would say. All right, Mark Lamont Hill, I want to thank you for hanging out with us this morning. I hope you come back.